But I think with telemedicine, there are things that we are exploring potentially to reach para-urban and rural areas, but that's a bit later. I wanted to do something that was very concrete and finite. If you look at healthcare in Bangladesh, based on my analysis, to get Bangladesh's health sector just to the level of India's would require more than $17 billion of investment. So the sky is the limit in terms of the need, but I wanted to stay very focused on this concept initially. But I also believe once we prove this, there are many other things we can do. I don't know if you want to add to that, Sanjeev.
Yeah, we are actually looking at all set of customers. It can be a corporates, it can be retail segment, and mostly the focus would be, for example, I'm coming up in Bonani area, so I'll be focusing in and around 10 to 15 kilometers. So I'll be basically a neighborhood clinic for outpatients with a concept of family physician, where there'll be personalized care, and also along with the diagnostic centers within the premises. So any patient who comes into Praava, it is like everything will be taken care of his past records, future records, and everything will be managed in a what do you call it as in the cloud, what we are maintaining all the standards. So this is going to be a very different experience, what most of the people in Bangladesh have not experienced yet. So this is something what we are working on, and touch wood, we are going to achieve this.
Our business is actually a social business, and your steps is very much appreciable, and we really appreciate that. My question is, fear of the population of medical services, the medical expenses. So, as far as your explanation, we saw that your system is going to be expensive. So, how are you going to be specifically facilitate the poorer community in our country who is not really is not able to afford their expenses?
So I hope it won't be too expensive. Actually, I don't estimate that it will be, as expensive as some of the high-end facilities in Dhaka now. I like to think that our pricing is approximately at market. That being said, it will be expensive for some segment of the population. So, prothome, we will not have options for the poor to access it. But once we achieve profitability, আমি তারপরে introduce করতে চাচ্ছি কিছু alternative financing models. Like there are models like cross-subsidy models, for example, whereby you use the profit you get from the paying customers to subsidize the services for poorer people. There is evidence that you have to charge people for healthcare, even among the poorest people. So we will have to charge something, I think, because otherwise there's a lot of abuse in the system. But we will be exploring alternative financing models along the way. But prothome, it will be purely out of pocket. I want to make sure that this is a sustainable enterprise.
Can you take one last question?
Okay, on the same line as the target customers. I was still wondering about your first problem that you mentioned about the trust issue. I understand that you'll be targeting the corporates, with packages and stuff like that. And I agree with you regarding that particular point that they have to pay. When somebody tells me people in the rural areas cannot afford it, I'm not going to believe it, because Square is bringing in people on helicopters from rural areas, and they're paying for this, and there are dallals working everywhere and bringing in customers on a regular basis for this hospital. So I don't think payment is the issue. The issue is I was to say that you mentioned first the trust issue. How would you get your customers to your doors? Just if you can clarify that a little bit.
So we are ramping up our marketing efforts right now, actually. We've been keeping a relatively low profile, quite intentionally, actually. But my marketing director is here, Jalil Khan, he's right there. And so basically, we are trying to empower the patients. Right now, what I see in the system, it's very doctor-driven. So doctors are basically dictating everything in the system. All of the big hospitals, except for, I would say, Square Hospital, to be honest, they're known and established because of the doctors who are sitting there. But we're trying to build a brand that's based on quality. But that requires raising awareness among patients, and it will take time. Right now in India, what I observed in my meetings that I had when I was doing research, patients know, I think Bangladesh is about a generation behind India, but patients know, like doctor maybe will say, get your blood work done at this place. Patients know I don't want to go there, I want to go to Metropolis or Dr. Lal, or there are a number of brands that are known for their quality. That's the brand that I want to be for Bangladesh. I want patients to know that if they send their blood work to us, they will not have to validate it because this is being done at an international standard. That takes awareness raising. I think that in terms of our marketing efforts, we are marketing to doctors, but we're marketing directly to consumers. If you go to our Facebook page, I don't think there are a lot of other, even now, I don't think there are a lot of other brands in Bangladesh that are doing much in terms of marketing to consumers. But we do have an aggressive marketing campaign actually that's already been ignited for consumers directly. We're also actually marketing to non-resident Bangladeshis. A lot of money is coming back into the country from remittances. As you guys know, it's one of the backbones of the economy actually. So another way that we envision that money can be sent into Bangladesh is by actually buying healthcare for your loved ones, for the services that will be rendered in Bangladesh. So those are other avenues that we're looking at. The biggest challenge, as I view it, is getting people in the door. I hope you guys will come. I hope you don't get sick, but if you do, if you need to have any testing done, I hope that you'll come and visit our facility. I believe that once we get the patients in the door, they will see that we're creating an experience like they haven't had before. That we're actually going to treat them with respect. Praava guides are going to welcome them into the facility. We are going to serve as Praava guides for a few hours every week, so we understand what experiences the patient is coming with. And that everyone in the facility is getting trained in hospitality, in how to treat people with respect. Because when you're sick, you actually are at your most vulnerable. You don't want to be dismissed. You want someone to listen to you and actually take care of you. And that's what we're trying to create. I believe that once we get people to visit us, that hopefully they'll come back.
Thank you. With this, we'll close the event. Can we get a round of applause for the speakers? I would also at this point like to kindly request our Honorable Vice Chancellor to take the stage and give